Mbale Referral Hospital and the health centers around the Elgon region are facing their worst moments as they run out of blood. According to the health workers at the hospital, for 2 weeks now, the hospital doesn't have blood, and so far more than 10 people have died due to lack of blood. Mbale Hospital requires over 200 units of blood daily to manage the overwhelming numbers of patients who flood the facility, but it gets less than 15 units of blood from the Mbale Regional Blood Bank. Many people attending to the sick are seen in a crowd lining up, while others even fell asleep after waiting for longer hours at the hospital blood lab expecting to get blood. Little do these people know that inside the lab there is no single unit of blood, as the blood fridges are empty and with no hope or any signs of getting blood soon. This shortage of blood in the hospital is putting many lives at stake, and many have lost lives. Most recent one was the pregnant mother Jacqueline Gidodo, who lost her life earlier last week after her people failed to get blood in time after giving birth and needed blood. Jacqueline died 4 hours after waiting. On that fateful day, they looked for blood from all areas from midnight till 3 a.m. in vain. Dr. Mbale Didas, the principal lab technologist in Mbale Referral Hospital, noted that as a hospital they need like 100 units of blood. But nowadays they receive 13 units, which is used up in just 30 minutes, and they can only be enough for like 4 babies.
That cannot be true because we run 2 shifts. We have the day shift that starts from 8 up to 5, and then the evening shift that starts from 5 up to 8 the following morning. Yes, this person at times can be resting, but we have a resting room which is next to the serving station. If someone comes, he can knock and this person will be able to attend to the person in need. Something that needs to be corrected, and I would request that the Regional Blood Bank should respect the normal standard procedures of sending blood and routing blood for blood transfusion through the Regional Referral Hospital laboratory. Yes.
In your view, do you think that there could be a problem somewhere? What could the challenges be?
The challenge, I think, which I see here is a two-way. One, on the side of the patient, and 2, on the side of our colleagues at the Regional Blood Bank. They should have guided this patient who got blood from the Regional Blood Bank direct to go through the hospital lab to make sure that they are escorted or make sure that they are assisted. The staff at the Regional Referral Hospital lab should have been the one to go and pick this unit of blood and then issue it out following the guidance, not giving this unit of blood to the patient direct. It is a great violation of procedure, and it is very, very, very unacceptable.
Dr. Abisa Julian, the in charge of the children's ward, told City Post TV that the children's ward is overwhelmed with a large numbers of children suffering from sickle cell and malaria.
The issue about blood is not a sustainable solution for this problem. If we treat these children very well, if anti-malarials are provided to the lower facilities and people use the right doses, they use the right drugs, the patients they eat the right food, iron-rich foods, such that they are not anemic, I think we shall avoid this blood issue, because like prevention, I'm now looking more at prevention.
Tabomba Ahmed, the head of blood bank, was offloading some blood, which he said he had just picked from Barara.
We've seen about a 45% increase in demand of blood. Previously, we had our calculations indicated that if we had about 4,500 units of blood within Mbale region, the Greater Mbale region, that would be enough. But now we're estimating that we need about 6,000 units of blood every month in order to meet demand. So it is about, we need an extra about 15 to 20,000 units of blood every month for us to meet demand. So this is a significant amount. 15,000 units of blood is a lot of blood. And as of now, while we are appealing to people to keep donating, increase donations, but as of now, the strategy which we are employing, which is a bit more successful, is to bring in blood from other regions. This week we are getting 600 units of blood from Mbarara, from Western Uganda. Then next week we'll be getting another 500 units of blood from West Nile, from our colleagues in Arua Regional Blood Bank. So we want to appreciate our colleagues across the country who are supporting us to respond to the epidemic.
The Mbale Referral Hospital Director, Dr. Stephen Obo, confirmed the death of the young mother and others.
Well, we usually try to coordinate with other centers. For example, a few days ago, we were able to get some blood from Ginger Blood Bank. And if possible, wherever possible, we are able to talk to other blood banks within the region and try to see, or other hospitals, and see if they can be able to support us. Although I know it's a big challenge.